Hello, I wanted to continue our discussions during this period of crisis. We're getting hit with all kinds of information. I think we're all becoming amateur epidemiologists as we survey the reality of this. And so I wanted to offer some of the perspectives that we've been teaching for a long time at the Acton Institute in the midst of this, to keep our thoughts stimulated and to see how we can apply the principles that we derive from abstract ideas largely, how these can apply in very concrete circumstances. And one of the questions that seems to be overarching is how permanent and how dangerous are the ideas of central planning, central government, socialist ideas that existed even before the outbreak of this pandemic, these ideas that have been making their way through the body politic, both in the United States and really throughout the world, how these are going to apply and will they become permanent? We have already talked about how the government intervention at such monumental levels will acclimate us to the acceptance of these as the norm. These exceptions cannot become the norm. If they become the norm, we will indeed have a cure that's far greater than the disease in a very literal sense. So there's all of that warning and that kind of negativity. But I also want to propose to you that coming out of this, there may be some innovative ways of thinking that will also be something that people can acclimate themselves to. What am I thinking of? I'm thinking of things like telemedicine. Telemedicine was considered very marginal and really by the medical establishment viewed very skeptically. Now, I think one of the reasons that at least some in the medical establishment and in the government is because it doesn't provide or it doesn't demand the kind of infrastructure, the big infrastructure that exists and all of the licensing requirements that go with that. Once we see people being able to be treated by medical professionals through telemedicine or through people in the medical field who aren't medical doctors, but who are pharmacists or nurses who can treat various levels of disease or discomfort and prescribe even medications that can help them. This begins to break up the monopoly in terms of medical care. And this can become very innovative, and as market processes and competition comes in to play, we can have a really astounding revolution in this whole field. Likewise, not just having to do with the licensing, which really needs to be questioned, but all of the regulation on these things, the access to various kinds of drugs that people will deem for themselves to be safe and needed. These kinds of procedures can loosen up an economy and allow people to be more creative, more responsive, all, of course, within the boundaries of safety. Now, who are the better people to ensure safety? It's, of course, people who are most concerned, most knowledgeable, and people to whom we have access and who we have trust in. So it needn't all be the negative response of the state coming in and replacing everything. There can be a lot of innovation that emerges and that markets can respond to. By the way, these same principles also apply to just something like this. This mode of communication, especially what's going on in schools. Many of our schools are educating children now. My own school, we're doing some homeschooling through these means, these new modern innovative means. What does this pose to the institution of the university? Is it necessary to have large institutions with large endowments and buildings when we can educate people much more directly, much more succinctly, much more personally than just having large institutions that are endowed and favored by government grants and things like that. So think in a positive way how there are a number of ways in which things can happen that aren't centrally planned. If you have additional ideas on this, I'd certainly be interested in hearing them. Just send them to the Acton Institute. Please know that you're in my prayers for your safety, for your family, for your well-being as a whole. May God bless you and sustain in you hope. God bless.